Good afternoon and good evening to everyone, and thank you to the Titan Academy for the invitation. I'm very pleased to be here, but in fact I'm at home, so but virtually to be here with you for these few moments that in this way we can relate also if not by the pandemic, but also to be internationally connected in the same time. I would like to pretend to be live, so with you in presence, and so feel free to ask questions or interact with me during this lecture. And today I speak about the integration of Titan in our practice routine. So in dentistry, in our job, our skills combined with the instruments that we have and the performances and the services that we can offer to the patients can directly depend on the instrument on the instruments that we use. And so the fact that we decide to include some instruments can make the difference for us and for the patients, and also, for example, for the technician that we work with. The instrument that we are talking about today is made for functional analysis of dental occlusion, and in a simple way that allows us to keep constant in our practice the concept of the centrality of the mouth, if we talk about a well-balanced system. With this instrument, we can easily transfer this concept to the patient because of the simple language that these instruments use. So this evening, today, I'll talk about the exam, what this instrument is, how the dispositive is made and how it works. I'll explain the indexes that we obtained through this exam, and we'll see some clinical cases. So first of all, we have to distinguish the moment where we could use Titan. Of course, we can use it during the evaluation of clearly TMJ disorder referred by the patient or already diagnosed by us. We can use it during every type of therapy to analyze if the good balance that exists before the therapy is maintained, or also if we have reached a better condition of balance. And it absolutely makes sense to use Titan during the first visit, when we know the patient and the patient knows us, and we collect all the information like the periodontal status, X-ray, and also the neuromuscular situation. This is the reason of an instrument like Titan is really important in this moment, because integrating this type of information where apparently good condition crashed due to the stress related to the pandemic, and asymptomatic disorders aggravated and became symptomatic. The pandemic doubled or tripled the patient with TMJ disorder. So it is important to have some instruments to early diagnose this type of problem, and to make the patient realize that this problem is real and can be read by a simple computer. So going to practical part, when we analyze a patient, we go through a checklist where we investigate the pain, the limitation, and if there are noises during the TMJ movement. So of course, every time the objective exam is really important, and the passages are always the same. So we feel the TMJ, we analyze the muscle like the temporal, the sternocleidomastoideo, the insertion of the masseter, and we check also the mobility of the mandible. And after, we can proceed with neuromuscular analysis. For this, we have to locate two couple of points where we are going to place the electrodes. These 2 points are for each side of the face, and we will place 4 electrodes, 2 on the temporal and 2 on the masseter. We do the palpation of the masseter, asking the patient to perform a full clench, and we place the electrode parallel to the muscular fiber and in the central portion of the masseter muscle. And for the temporal, we have to identify the major axis of the zygomatic process of the frontal bone and apply the probe along with the muscle anterior margin. We stay close to the coronal suture and keeping about 2 centimeters from the zygomatic process in this way. Sorry, I have to. Okay. This is the correct position of the electrodes. And in the other side of the patient, the face, obviously, we do the same thing. Before we start, we need to calibrate titan, and for this we make the patient clench on the 2 cotton roll, 1 by side. With the calibration, we are sure that the result will be describing accurately what is happening in that precise moment. So we need to calibrate not for every analysis that we perform, but for every session. So day by day, we need a new calibration. We, for the test, we remove the cotton roll and make the patient perform a clench for a few seconds. This act will give us several information. You see the blue target refers to the activity of the muscular of the temporalis muscle, and they govern the front of the mouth. The pink target refers to the activity of masseter muscles that we identify with molars that govern the back of the mouth. Immediately beside the image, you see the green circle that is the index of neuromuscular balance. And this index includes the values of the indexes that are written below. And it is represented with a green ring if the overall balance is higher than 83%. Yellow if it is between 82 and 75%, and red if it's less than 74%. It describes an overall view of the balance. And now we explain the indexes that are written below. So we have the percent of overlapping coefficient of temporal and masseter muscle. This is the assessment of the symmetry prevalence within the same muscle pair. You can see that the POC is evaluated between right temporal and left temporal, right masseter and left masseter. Below we see the barycenter, because BAR is the assessment of the position of the occlusal barycenter. And so we see if the barycenter here is more shifted on the temporal muscles or shifted on the masseter muscles. Below, we see the torsion assessment. It is assessment of the torsion attitude of the mandible in the horizontal plane. The impact, you see as the last index, is the assessment of the muscle activity. You see that ideally it should stay in a range between 85 and 115%. And you have the index of the asymmetry. You have the symmetry between right or left. Right temporal and masseter, or left temporal and masseter. An important notice is this, that the torsion clinically corresponds to prevalent contact in anterolateral sectors of the dental arch, or insufficient contact in lateral posterior sectors. It is the torsion. It is generally related to the temporomandibular joint disorders. So typically, patients that have torsion, and we will see later some examples, are typically the patients that are symptomatic or likely will be in the future. And if the torsion is associated with low impact value compared to the standard, it may indicate the presence of both pain and protective mechanism in nociceptive stimulus, because the patient feels the pain due to the torsion and instinctively applies less force during the clenching. And the impact indicates the muscular activity, and important is how we read it, because if the indexes are normal and the impact is related to the vertical dimension, so the user can raise, okay, the vertical dimension, or we can reduce it if the index is lower than normal, because usually if we have a high impact, we immediately see that if we interimpose something in the teeth, like some raise on the molar, on the premolar, immediately the impact is lowering the value. And the contrary, if we have a low index about the impact, and we decrease the vertical dimension, usually the impact increases. Then we see a graphical representation of the occlusal balance. So we see that ideally we have 25% for each area. We see represented the activity transfer to the electrodes, and then we have a summary of all the indexes. You can see that whereas there is something that is not in the normal range, the system highlighted in red. In this example, we have every value in the range. The only thing that is out of the range is the barycenter, that is slightly anterior, but being out of the range, the system highlighted in red. We have also the feature of the chewing exam. For the chewing exam, we need to make the patient chew something like a chewing gum, because it has the chewing gum has a constant consistency, and we make the patient chew to the left side and to the right side. And we have these indexes of the after a few seconds. We have the frequency that describes the numbers of chewing acts per second. The temporalis impact, the index of the muscular work performed by anterior temporalis during the test, and the masseter impact, and it is the index of muscular work performed by the masseter muscles during the test. The last index is the working side impact, that is the muscular work of the right side for the right temporal and the right masseter, and of the left side for the left temporal and the left masseter. I usually take also an impression, a digital impression of the patient, and combine it with the titan, because I immediately see I can see the movement, but more I can see the contact point, the virtual contact point, and for example, if I see high activity of the temporalis muscle, usually I see strong contact, in this case red contact, on the premolar. And so I can explain, I can evaluate by myself, but I can explain also to the patient very easily where is the problem. So now we are going to see some clinical cases. And as you saw, the exam is very simple to do. And it can help us every time we need some more information. Also, when we see something that we can think is suspect. Okay. So the first case is of this patient that had these all veneers, and in a few months, in 2 or 3 months, chipped 3 of them. The 2 centers and the upper right canine. And this is what we saw in her mouth. She had abrasion in the posterior teeth. So we perform an exam, a titan, and this is what the exam showed us. This was a very critical condition, and by the way, she was also suffering of backache. But notice the value of the impact. This is 377%. The normal range, normal limit is 115. In general, a situation like this can be described as a loss of posterior vertical dimension and a prevalence of contacts in the anterior teeth. And that is why she broke the veneers. So we fixed the veneers and spoke with the patient about the importance of more complex treatment. She would need, as I said, a raise in vertical dimension. She postponed the problem, but to partially solve the problem, I simply covered with a small amount of composite some of the abrasions. And this is the exam at the beginning. Look how it changed after I managed some of the abrasions. The improvement is clear. The impact is still high, but compared with the initial exam, it is better for sure. This is another case where I use Titan only to communicate with the patient because she was a patient that asked for anesthetic treatment of the frontal upper teeth. She had a good vertical dimension, and in the posterior and lateral region, she had crowns, ceramic crowns. But for the patient was only an aesthetic problem. We can see clearly that this is not an aesthetic problem, but there is something strictly related to the function. So the patient is likely a bruxism. We perform a Titan, and we can see overall a good balance. But we can see that the impact is quite high. So we told the patient that we can solve the aesthetic problem, but the fact is that we have to consider that the impact is quite high. And so the best treatment would be integrate a treatment, the aesthetic treatment, with a treatment of the bruxism, so with a splint or something else. So we go through with the analysis, the mock-up, and the final veneers. This is a few weeks after the bonding, and look at the right canine. She had a chipping that we had to solve. She expected, she didn't do anything at that moment for the bruxism, but she expected something, some damage to the veneers, because we clearly spoke with her about the criticism about the impact that Titan showed. She decided to not perform at that moment due to economical reason the treatment for the bruxism, and she had the chipping that we had to repair. And in this case, probably the best treatment for her would have been the Botox to the masseter that solved also the importance, the prevalence of the masseter. This is a young patient, and this aberration usually we can see clearly in elderly patient, but in a young patient we have to do ask some questions. We can see clearly that there is something that is working that is not working very well. We can see this abrasion and this abfraction. We take digital impression and look at the upper arch how is contracted in the lateral region, and she performed orthodontics. This is the initial Titan before the orthodontic treatment, and we can see clearly that there is a prevalence of the left side. And look at the photos. Look at the masseter muscle, the left masseter muscle. There is a clear asymmetry. So we started the case with the digital impression and the CVCT, and we thought about the orthodontic therapy to be performed with aligners. So the patient started treatment, and every check that we did, the masseter slowly decreased its volume. So you see the first photo and the last photo. Okay, so I'm waiting for the last data for her, but I'm sure that that it should be good. So when we approach a case that is we saw some cases, routinary cases, prosthetic, ortho, and so on. But when we approach a patient that has a TMJ disorder, we have to clearly know what choices we have in terms of therapy, because we have cognitive, we have the counseling, first of all, we have cognitive and behavioral therapy, we have occlusal splint, but we have also physiotherapy and osteopathy. This is a male patient. This is a victim of the pandemic. This is a male patient, 29 years old, natural dentition. He had a history of vertebral separator, and for this reason, he had this vertebral separator. Then he had pain, so he removed this separator, and he underwent to postural rehabilitation for years. And he came to the clinic because he noticed that he started to have clenching episode during the day, and probably bruxism during the night. This is the first exam that we performed. You can see that the worst index that we have is the torsion. The torsion with a low impact. So probably the patient had pain, and so his muscle decreased the activity to protect themselves. Okay, so you can see here after a treatment with the osteopath, and then I choose for him an occlusal functional therapy combined with cognitive behavioral therapy. For this type of therapy, I like to use this app because this app sends notifications that make the patient think about this the actual condition. So if he feels that the muscles are relaxed or not, and at the end of the week or 2 weeks where the patient uses this app, we can have a report of every episode that the app collected during the period. And it is something also related to the mindfulness. So being present at the moment and be conscious of everything, not letting the automatic pilot take the control. So as I said, for this patient, I use this TMJ appliance, and combined to the osteopath therapy. 1 month after the first visit, this was the condition of the patient. Also in this case, look at the impact. It is over the range, but you have to consider that the patient started from a value of an index of 55. So this is a positive index for me, because it means that the patient began to use normally his muscles. This is another case. This is a male patient, 21 years old, natural dentition. he presented to the clinic due to the muscular lock. He felt pain in the right TMJ. He was a sax player, so it was like a job that it not very easy to manage. This is the indexes of the first titan that I acquired from him. You can see clearly that he has a prevalence of the right temporal muscle, exactly where he feels pain. He have a posterior barycenter, and he has a torsion because he has a prevalence of the right masseter and the prevalence of the he has a prevalence of the left masseter and the right temporal. So it means a torsion. The impact is normal. You can see that the left temporal muscle is working, and we can see that we have a right asymmetry. First therapy is to stimulate the patient to mobilize the mandible to solve the lock. We produced an occlusal, an individual occlusal splint. Look also at the deviation that he has. So the lock was only the top of the iceberg, but he has several problems that are being worse due to mainly to the instruments that he plays that constantly make he feels the muscle rigid and constantly under pressure. He was treated also by the osteopath, and after a few months, the overall value are very better. The barycenter was slightly anterior, but we see that overall in the complex it is very good, and the patient solved the lock, the mandibular lock, of course, but also the pain at the right side of his face, located in the temporal margin, is it is disappeared. This is the case of a woman, 47 years old, with natural dentition. She also presented to the clinic with an oral facial pain, and this pain was triggered by a point that was located to the right temporal muscle, and she was treated immediately by the osteopath, and this is the indexes that we collected before the osteopath treated her, and we can see that again the pain is related to a torsion, a mandibular torsion, because we can see that the right temporal muscle is working more than the left temporal muscle, and the left masseter muscle is working more than the right one. The barycenter is posterior, slightly posterior. We have this important torsion, and we can see again that the pain make the patient muscles work below the normal levels. So we see that the impact is under the normal range. We see that we are totally out of the range. Okay, here we can see in the summary, the red dot are the indexes that are not normal. The osteopath treated the patient, and after 3 days, 27 January, 30 January, we can see that the pain disappeared, and the indexes are very well. The torsion disappeared. So in this condition, we are going to perform an individual occlusal splint. The osteopath kept working on this patient about the proprioception, and this splint was to aim to decompress the TMJ. Okay, so we saw the clinical aspect. We every instrument that we buy, that we include in our routine, often has a very important marketing aspect. But I like to think about the marketing as the clearest expression of what we really do in our routine, without sensational messages. And what is important is that the patient needs to be educated again to what is the real dentistry, made of an attention to an holistic approach, taking the right time for every therapy, having respect for the biology. So I like very much the concept of slow dentistry. So I'd like to thank you for the attention, and feel free to ask questions. Join me via social that are I was an antisocial, but the pandemic made me realize that the link that we make virtually can be maintained and be developed in the real life for sure. Thank you.
Thank you, Dr. Baruffaldi. So now we have some questions. So do you use Tethan on all your first visits?
No, I use Tethan in the first visit, before and after the therapy, and also in the TMJ disorder visit. But at this moment, Tethan is like an X-ray. It is not invasive, but is an easy exam like an X-ray. It is fundamental for me to take an overview of the neuromuscular activity of the patient.